what I want to do is rattle through the presentation. If you have a comment, question, query, thought, put it in the chat and Tracy will collect that, and at the end we can go through that information rather than stop-start all the way through. We'll get going. So this is the introduction to our piece of work here around pathways to community wellbeing, reducing alcohol-related harm. By way of background, we acknowledged right from the start that communities throughout New Zealand are actively implementing and establishing all sorts of innovative programs and initiatives in this space. And we just wanted to complement that, not so much to reinvent the wheel, but to try and add value to the process that is being done in communities around the country. So we're looking at some tools to address alcohol-related issues in a systematic way, resources to help implement interventions, sources of data, and some examples of proven programs. It's by no means definitive, but it's to prompt your thinking and to give you some incentives and encouragement. So it was developed by me and Tanya at the foundation, and it was funded by the Health Promotion Agency. And I acknowledge right from the outset the invaluable support from Alicia, Michelle, Sania, and Wayne, and your respective colleagues, and the input that you have given me through the process. It added enormous value all the way through, and I hope you could see where those changes were and recommendations were implemented. This is a generic presentation. It is being recorded, and it may be used by groups that are not part of Safe Communities. So I have got a slide in there just describing a little bit about the Safe Communities Network. The resource is divided into 4 sections: problem identification, problem definition, data and research, wellbeing indicators, and pathways and implementation strategies. So I want each of these sections to be discrete, because you don't want to go to section 4 and have to scroll all the way through to get to where you want to go. So each section is discrete. So section 1, talking about problem definition. Now, I don't know whether Einstein said this or not, but it's still a good quote. If I were given an hour to save the planet, I'd spend 59 minutes defining the problem and 1 minute resolving it. And I think that's sort of sets the scene. So there are really 3 components in this section, which are tools or toolkits to help your thinking around problem definition. And it's really to mitigate the risk of just leaping into solutions and leaping into things you know or familiar with without really thinking through and defining what the real issue is, what the context of it is. Are there ways to reframe it? The Community Toolbox, I really like the force field analysis component in there, which is really saying, how do we define what are the forces at work to maintain the status quo versus what are the forces at work to promote change? And it's another way of just thinking through the context in which we work in the area of problem definition. And we don't want to get into a situation where we have paralysis by analysis, where we simply are frightened to do anything because we don't think we've got enough information or we don't know enough. But on the other hand, we don't want to go leaping into things simply because we've done it before, or it's tried and true, and we haven't really thought it through to make sure that it's going to address the particular issues that we've identified. I also acknowledge Vibrant and Safe Waitomo for their life course matrix that I know they presented at National Forum. And it's, again, a very visual tool for looking at how to identify risk factors and protective factors at key life stages, and looking at maybe how you can address things before they get to critical stage in life's pathway. So problem definition, food for thought, just to get you started, in the process. These are tools that are really useful if you're working with groups of people who are coming from diverse backgrounds and perspectives, And it's a way of just making sure that you capture a full and thorough picture of the issues that you're trying to address. Section 2 really relates to data and research. And first up, if we look at sources of alcohol-related harm and statistical data, it's been mandatory since July 2017 for district health boards to collect emergency department data on alcohol-associated status of patients. What we know, though, is that the data that's available is of variable quality, and each district health board has different ways of collecting or not collecting it, and there are issues. But as a starting point, it's a way of getting some raw data about emergency department presentations, who they're seeing, who they're screening, what they're doing with those people at that point of entry. Now, health space and the environmental health indicators, and they come up again a bit later on in the document, there's national and regional data available on alcohol-related harm, and that includes issues like the density of licensing alcohol outlets down to an area unit level, harmful alcohol use, hazardous drinking, hospitalizations, alcohol-related motor vehicle crashes, injuries from alcohol-related motor vehicle crashes. And that data is free and it's available on their interactive website. Now, all these things are linked in and through the document, so I haven't reproduced all the links and things here. Now, Stats New Zealand produce a variety of different data sets, and they also appear in the Wellbeing chapter. But they have wellbeing statistics that are time series, so you can actually look at the progression 2014 to 2018, looking at issues like overall life satisfaction, financial well-being, general health. These are just really useful backgrounders when you're trying to set the scene and contextualize any particular issues that you're wanting to address. Are you seeing particular issues or trends in your community that may be contributing factors or precipitating factors that are leading to alcohol-related behaviors and harms and so on? So that's a really good source of material, and this is stuff that you can use across a variety of different issues, problems, and so on that you're looking at as a community. And again, the information is free and it's available on the website. Now, IDI, or Integrated Data Infrastructure, this is the holy grail of data. And it's a huge research database, and it isn't one you can just tap into. You need to be properly accredited researchers to access it, but it pulls together huge amount of data, albeit that the completeness of it may vary. This is really where all of the government data all comes to rest, and but through the proper channels can be accessed for research purposes. In terms of alcohol-related harm research, this is really looking at this could be survey work, it could be all manner of research done by government and non-government agencies, and I've just identified a few here. The first one, of course, is the Te Herenga Hauora Health Promotion Agency. They're really the lead agency as far as alcohol research is concerned. They look at indicators, behaviours, attitudes. They publish regular updates on current research, and you can sign up and receive their quarterly updates on their most recent research. Their publications database lets you search published reports, methods, questionnaires, fact sheets, infographics across all their program areas. A huge source of really relevant and useful information. Alcohol Health Watch is another organisation that has a catalogue of research on advertising, marketing, sponsorship, drink driving, fetal alcohol, spectrum disorder, legislation, policy, and all of these things. And Alcohol Health Watch has been around for a long time, and they set themselves a high standard in terms of the quality of the material they produce. And again, it's just good background information. If you're making a case for funding, or you're making a case to your local council or district health board for funding or resources and what have you, drawing from the likes of Alcohol Health Watch and so on, lends credibility to what you are trying to achieve. Another one, Shaw and Whariki Research Centre. This is they operate on a bicultural model, and they have an extensive library of research and analysis. There's some good solid academic stuff, and they also host the national coordinator for KAD, the Youth Alcohol and Drug Program. So they're a hands-on organisation, but they also have any amount of just good quality research that you can tap into to underpin what you do, and what to persuade, if you need, the people that you need to have influence over.
Because all the
what's actually not.
I mean, so I can't, like, I'm up.
Now somebody, oh, there we go. Now the Australasian Injury Prevention Network is primarily Australian in its settings, and but again has a huge amount of information, academic and government sources, and a lot of that is transferable. It's translatable. You can look at it and interpret it into a New Zealand context, and that's again another localized, well, semi-local source of research. The Australians do a whole lot more than we do, and most of it is of value. Now we decided to put the well-being indicators into a category of their own, and really that was because it's really the determination of the government, the new government, our re-elected government, if you like, that the shift to well-being means we can now measure progress in lifting people's quality of life and reporting on the things that people care about, such as the environment and social connection and so on. So we just felt that anything that we're doing in this space really needs to be embedded in these well-being indicators, both at an international and also at a national level, so that we can show that we are consistently and in a methodical way, contributing through the work that we do and through the work that's being done on the ground out there in the community. So we start by looking at the international scene, which really is anchored in the Sustainable Development Goals, and a number of you have been kind enough to host me to run workshops on that topic, and so I won't say any more about that, other than to highlight the ones that particularly relate to alcohol, which is goals 3.5, 351 and 352. So everything we're doing in this space is contributing, to that greater good, if you like, or that greater whole. At a national level, there's been a lot of movement in this space, as I've already said, around well-being, and it's been led at the top with the local government Wellbeing Amendment Bill, which has reintroduced the 4 well-beings around economic, social, cultural and environmental. This now becomes mandated business for local government, and that's an important step. I think it gives us some leverage with our councils to be able to say, you can no longer hide behind roads, rubbish and rates, but you have a mandate now to operate in the social, cultural, environmental space, and the work we're doing in safe communities pretty much across the board adds value to the work that they are now mandated to do. The Living Standards Framework, developed by Treasury to provide more comprehensive economic policy advice to government. I think they've gotten the message that that it's more than just GDP. It's more than just money and economics in terms of dollars. And I think there on that the links to the Living Standards Framework, there's a series of videos by Treasury's people talking our language, and I found it quite a treat to listen to government economists talking about social well-being and living standards and people's social connections and all that kind of thing. SOLGIM, the Society of Local Government Managers, for those of you who are unfamiliar with that acronym, offer a community wellbeing service, and they will provide customized reports with any number of indicators and measures for your community. That is a fee for service, so it would pay to see if your councillor already subscribed to that and how you can access it. It's a great resource. It's one of a number that are trying to paint that much more holistic picture or approach. Stats New Zealand, as I say, have always provided data, but now they're starting to look at well-being and sustainable development as measures. And so they're looking at social capability, empowerment and enablement, human resource potential, economic self-determination, environmental sustainability, and te ao Māori, partnering with Māori. This is great to see, you know, our government lead agencies taking it forward in these ways. And again, you can spend valuable time just trawling through these websites and just getting your head around what they can actually give you in the way of useful information. Now, I talked about the environmental health indicators before. This is actually run out of Massey University and funded by the Ministry of Health. And it looks at all of the things you might expect to see in terms of environmental health: air, water, UV, hazardous substances, and then they're tacked on the very end, alcohol-related harm. And I thought, okay, that's useful. But it's good to see that it's contextualized, not just as a medical issue or as a purely a health issue, but it's looking at it in the context of the whole of community and the whole of environment. So again, really useful. It's all free and available, and that was a real eye-opener for me. I prior to setting this up, I didn't even know about this stuff, and I just thought, yahoo, you know, for anyone who's inclined to want to delve into it, there's treasures aplenty in there to actually find and see. And then you start looking at the connections and the way one interacts with the other, and it can really get your mind working. At a regional and local level, cities, districts, regional councils, and I should have district health boards as well, are initiating wellbeing research and reports for their own districts. And in the document, you will see links to, I think, the Waikato Regional Council, Wellington City. I think there might be some Napier Hawke's Bay in there. But there's, again, the councils in response to their mandate are actually, some of them are really getting on board with this and taking it seriously. And so they're producing all sorts of information now, which perhaps wasn't always in their frame of reference, but that they're starting to see the value of, and that you can tap into, but also contribute to as well. And it's not just government. Infometrics is a private sector firm, but they have developed a wellbeing framework as well. And they've got a number of reports that they've done on areas around the country. And they look at these raft of indicators: civic engagement, health, housing, income. Some of this is driven from the census, some of it's driven from the other sources that we've talked about, I guess. But they put a particular interpretation and they develop these reports. So if they're relevant and available, we need to be using this information to enhance the quality and the scope of the work that we do. And Profile ID essentially does profiles based on the census data. And so all of the categories that you're kind of used to seeing in the census, they generate these easy to read, easy to digest reports. Again, it's all free and it's available there. on their website. So I guess I'm giving it a once over, but what I'm trying to highlight is that there's a wealth of quality data out there. And if people go, oh, I can't get any information, oh, I can't get any data, maybe these are some new places that you can go and look and maybe find some things that are going to be of assistance to you and your work. Now, we get into some interesting stuff now because we're going to start talking implementation and strategies, and this is deliberately left to number 4 because we don't want everyone rushing into this first, because unless you've done your homework, it's going to be too tempting to just try and cut and paste and grab some of the stuff out of here. But nonetheless, it's useful for you to see and encouraging, I hope. Now, the prevention paradox. Basically, the prevention paradox says that the majority of alcohol-related harms in the population occur among low to moderate risk drinkers, as they're more numerous in the population. Although high-risk drinkers have a higher individual risk of experiencing alcohol-related harms. And I've had several discussions with people about this, and they kind of go, nah, that doesn't sound right. If you're a low to moderate drinker, how does that make you in the high risk kind of population? And of course it is about the numbers, but it's also about our mental attitude towards alcohol generally, which says, well, if I'm a low to moderate alcohol drinker, the problem is somebody else. The problem is that young person binge drinking on a Saturday, or the problem is that person with a dependency issue, or the problem is somewhere else. It's not me putting 3 bottles of wine in my supermarket trolley because I'm okay. And at the end of the day, no one really wants to take on board the issue of saying to people, actually, we'll all be better off if we all drank a bit less. So the responses to this paradox are that we must have population level policies that are effective against alcohol-related harm, that curtail overall drinking and reduce hazardous consumption. And like I say, who wants to take that message out there? But that's a challenge. And we need targeted policies and interventions that complement those population level policies. In other words, yes, we deal with the young people who have binge drinking on a Saturday night, or yes, we're dealing with particular targeted groups who are getting themselves into potential problems and high risk. So that's where the paradox sits, and I guess we need both population level and targeted policies and interventions to really be effective. Now, this is just an example of some of the work that's been done in New Zealand over the previous years and by some agencies. You know, the Law Commission 10 years ago wrote the did the review of the reform for the New Zealand's liquor laws that resulted in the Act in 2012. A lot of the things that were recommended, and particularly the population level things, just never happened, or only happened in a very watered down way. You've got groups like Alcohol Action that came up with their 5+ solution. You've got the New Zealand Medical Association putting forward policy and briefings to their own medical practitioners. You've got the Health Promotion Agency actively promoting policies to address population issues. So what I thought I would do was the WHO have released their SAFER initiative, and it really sets out globally, really, strategies that are evidence-based and internationally tested and proven that have a high probability of success. And so we're using it as a framework here for categorizing or clustering the approaches to addressing alcohol harm in a systematic way. The web links that you'll see in the document take you to detailed descriptions of each one of these sections. And then I've presented some case studies that are presented as examples to stimulate your thinking. And of course, to remind you that there's many more case studies in the library on the Safe Communities website. And so it's an acronym, SAFER. And we're just going to quickly walk through these. Oh no, we're not going to quickly walk through those. I'm going to let you do that when you read the document. Okay, so strengthening restrictions on alcohol availability comes back to our issues around licensing, hours of sale, all of the things. And of course, the opportunities to intervene there are with local alcohol policies and a raft of other initiatives that can be done that address the availability and the distribution of alcohol, it's all that kind of thing. The A stands for advancing and enforcing drink driving countermeasures, and that can be anything from working with young people in drink driving, working with convicted drink drivers, police enforcement, everything that's required to address drink driving. Now, facilitating access to screening, brief interventions and treatments. I mean, these are well known and well proven to be effective. And in the document, you will see some examples from various places around New Zealand where these have been done and being offered through community alcohol and drug services and other providers. E refers to enforcing bans on comprehensive restrictions on alcohol advertising, sponsorship and promotion. And there's some really interesting examples there. And I've quoted, I think, Auckland as one example where they've prohibited alcohol advertising on buses and bus shelters and bus terminals and things like that. I think that's somewhere else in New Zealand as well. I mean, there are just things that you can do to give effect to these. Raising the price on alcohol through excise taxes and pricing policies, well, that's just one the government didn't want to touch and doesn't seem to have a mind to do anything about. But certainly that's been one of the drivers with the smoking cigarettes, is to keep raising the prices. But minimum pricing policies have been proven to be effective overseas, and we can lobby and promote those things. So under each of those headings in the document, you will see descriptions, some examples of activities that could be done, and some case studies where they've been put in place in New Zealand or around the country. And I thank you all. Most of you, I think, have shared with me case studies and so on. And that part of the document is still going to be a living and breathing document, because we will just keep adding to that as more information comes to hand through annual reports and so on. And the last little bit is talking about potential community partners. The Health Promotion Agency is partway through funding a pilot project with, I think, 4 or 5 community law centres around New Zealand to provide legal advice to community groups that want to object to the granting or renewal of alcohol licences. And you may recall, I think at National Forum last year, we had a presentation from a woman from Wahoroa in the Waikato who had worked with community law in Hamilton and had successfully opposed the establishment of a liquor licence in their community. And that seems to be a very effective way of mobilising communities to address liquor licensing, and I would think probably make submissions on local alcohol plans and all that kind of work. So that's a community partner that maybe you have or haven't thought about joining with on this. KAD, Community Action on Youth and Drugs, been around for a long time, KAD. It's one of those programs that seems to have survived when many other sources of government funding and what have you. Predominantly Māori based, not all exclusively, but there's a strong body of practice and what have you right around the community, right around New Zealand, mainly in the North Island, but some in the South. Good community partners. Your DHB, Community Alcohol and Drug Services and related youth services, they're very hands-on. they not only do they deliver services, but they will have a note of who all the contracted NGOs are as well, working in that space, and they're potential partners. Kaupapa Māori services, Māori Public Health, Māori Wardens bring a whole new dimension to what's proposed, what's planned, what's being offered, and we strongly encourage you to join and work alongside Māori colleagues. City and District Council licensing inspectors. Now, sometimes they're not all that helpful, but for the most part, they have legal and administrative responsibilities around liquor licensing and a detailed knowledge of on and off licenses and the businesses and the people running them. Same with local area police. Not only do they go out and arrest drunk people and clean up motor accidents and deal with a whole lot of crime related or offending, they are also active in the role of granting licenses, monitoring and prosecuting breaches of the Act, and providing policy and regulatory advice. They need to be at the table. The same with public health. They have a key role in regulation, licensing, and policy development. These are organisations that you really want around the table when you are looking at your alcohol-related harm. The Ngo sectors. Now, there's a link, I didn't put it here, but there's a link for a comprehensive directory of services that has an 0800 phone number, and it's really useful just as a way, again, of identifying who's working in your area, whether they're physically based there or whether they're providing phone or other forms of interventions or support. The New Zealand Drug Foundation are always a good source of information, advice, and I've noted in that column too that their Tuturu program offers a step-by-step program for schools. That is a whole of school approach to wellbeing, and I know that that got strongly endorsed by several of you folk when I was putting this together, and so I'm keen to emphasize that in this presentation as well. Students Against Dangerous Driving, I'm on their email list and they send out their up-to-date newsletters and all the rest of it, and again, just another source that could be a valuable connection. And last but not least, Healthy Families. It's a nationwide program that looks at physical activity, nutrition, smoke-free, and reducing alcohol-related harm. And so I know some of you will have had experience working with any, all, or some of these partners, and so we highly recommend them. And look, that's as much as I want to say for now. There's the link to the document. It's on our website. Any and all feedback will be valuable and appreciated. And as I say, we'll just sort of review it and update it from time to time. And if anything